reportedly been raped at a Durban and Coastal Mental Health Centre in Durban. The centre has confirmed the incident but refused to provide further details.
SABC News has been reporting on a number of cases of exploitation and abuse of mentally ill patients at the institution.
The Durban and Coastal Mental Health is on the firing line again. Another case of sexual abuse. Just last week, the SABC spoke to relatives of a rape victim. The victim was allegedly repeatedly raped by another patient. Family members accuse staff of being negligent. The head of the home, Gita Harry, has confirmed the sexual abuse case.
And in respect to this allegation, the matter has already started with its investigation.
The Democratic Alliance and ANC members in KwaZulu-Natal visited the Sherwood branch. Both have called for a thorough investigation.
The Department of Health and the Department of Social Development are the one who is funding this project. We are saying they must come closer and intervene.
I would be compelled to proceed legally by going to the nearest police station and reporting such an incident.
The Durban and Coastal Mental Health Centre says it will meet with a security service provider to address security concerns. Last week, the SABC News found that the institution has been using patients as security guards. Mlungisi Khumalo, SABC News, Sherwood.
Okay, let's get more on this story now, and our reporter Mlungisi Khumalo has been looking to the plight of people living with mental illness for some time now, and he joins us now live from our Durban studios. A very good morning to you, Mlu. What has the SABC managed to uncover during the team's investigation into the Durban and Coastal Mental Health Facility?
Well, a very good morning to you, Glenn, as well as to our viewers at home. Before we get any further, I'd just like to briefly paint you a picture as to what's really transpired when the SABC went undercover, trying to uncover the veil that has been there for quite some time at the Durban and Coastal Mental Health Institution. Now, not so long ago, the SABC was approached by a whistleblower who had a few complaints about the institution, saying that the place was a place that abused its patients. It was a place that exploited some of the patients, and it was a place where there was a whole lot of sexual assault taking place in that area. Now, just to briefly go back a few weeks ago, when the SABC went there, the first thing that's happened when we approached the gates of the Durban and Coastal Mental Health is that we were approached by a patient who said to us they are a patient and that they are also a security guard. Of course, this raised a whole lot of alarm to us as the SABC team. In fact, we said to them, how can you be a patient and how can you be a security guard as well? Because first and foremost, you are not trained to be a security guard. Secondly, you are being placed at harm's way. Well, he basically said, well, I'm a security guard because the institution said they are going to pay me 180 Rand a month. Yes, we also visited another branch of the institution, which I will name. It happens to be the Bria branch, as well as the Wentworth branch, as well as the Phoenix branch. So when we got to the Phoenix branch, a similar incident occurred. We were also greeted by a patient who also said that they were a security guard. The first thing that they did when they saw us, they actually asked us for a 2 Rand. What? Now, upon further investigation, we spoke to the patients, and he said, no, I'm also a security guard at the institution, and I get paid 200 Rand a month. Now, of course, that raised a lot of alarm. Now, as the week progressed, we unveiled another story at the institution where a family member of a victim who claims that they were sexually assaulted at the institution. In fact, she said that she was sexually abused and raped by another patient repeatedly. Of course, that further raised a lot of alarms to the SABC. But as we dug deeper in trying to scratch the surface, we also spoke to another relative of a victim who said that their 50-year-old relative had been beaten up very badly by a worker who works at the Durban and Coastal Mental Health Institution. Now, when they narrated the story to us, they said they could actually see on cameras, they saw their relative screaming at the worker, saying that, please, can you please assist me? Can you please change my nappy? My nappy has gone very dry. And of course, the relative said to us, this patient was ignored by the workers. They then said that in the evening, they saw their relative crawling, getting out of the wheelchair, crawling. And the next thing that they knew, the victim was locked in one of the rooms at the institution. Then they said the following morning they could also see again their loved one crawling out of that room. And upon close further investigation, they said that when they spoke to the patients had bruises and one of her eyes unfortunately was beaten with a shoe. And they also said they took the patients to the nearest doctor for closer examination. They found out that the patients had been slapped with a shoe on her buttocks, and also found out that she had lost her eye through the incident that's transpired. Unfortunately, now we've gotten reports, doctor's reports. They said unfortunately the patient is now blind because of an infection that's moved from one eye to the other. And yes, of course, yesterday we engaged with the management, and we also managed to find out that another patient unfortunately was sexually abused in the same institution. Of course, they said that a thorough investigation would be conducted very, very, very soon. So just to put it in a nutshell, those were some of the allegations that we have encountered. And of course, not to leave out the story of 24-year-old Ntando Dlamini, who apparently had an epileptic fit at the institution. The family claims that the epileptic fits took place at around 9 o'clock in the evening. And of course, the following morning, when the staff at the institution walked in just to come and do their daily routine, they found 24-year-old Ntando who was sleeping on the bed. Unfortunately, Ntando had suffocated because he could not breathe properly. Now, the family said their gripe with the institution is that they do not have properly trained nurses to take care of such patients. You'll also understand that Ntando was a patient who took a lot of medication. So the family said that they feel as if there was a whole lot of negligence from the Durban and Coastal Mental Health Institution side.
Indeed, shocking revelations coming out of the story, Mlungisi. At this stage of your reporting, though, are you seeing any parallels with the Life Isidimeni story? Well,
at the Life Isidimeni, a lot of patients unfortunately lost their lives, they demised. But in this particular incident, we are seeing sort of a parallel structure that is happening, because what really transpired at the Life Isidimeni, there was a whole lot of coverage. People were not being accountable, and nobody wanted to really say what was happening. Now, in this particular case, we've seen a similar scenario. Management is distancing themselves from all the allegations that's happened. Of course, we had a patient that was raped, we had a patient that was tortured, we had a patient who said to us that at the institution they are given stale food, and of course we've had family members saying that the institution is trying to cut costs by not employing security guards, but are instead using the patients as security guards. So for now, it's still a bit too early to compare the two, but yes, there is a bit of a similarity in those very two cases.
So what's next, Mlu? What are authorities saying about these allegations?
Well, funny enough, last week we received the statements from the Department of Social Development in the province. In fact, in their statement, they said that if the allegations are true, then of course this would be a very, very, very sad day for the country. And of course, yesterday we've had the Democratic Alliance in the province. They went to do an oversight visit in the area. And after they had conducted their visit, they said that somebody has to be held accountable, and they want the institution to be more open to the public's questions. And of course, as the day progressed yesterday, we also had the African National Congress in the province. We had members of the African National Congress in the province also visiting the area, saying that no, they were not too happy with some of the explanations that they had gotten from the head of the place, who also happens to be Gita Harry. In fact, they called for the Department of Health, as well as the SABC and also the Departments of Social Development, to also go in there and investigate the claims, because they are not too happy with the explanation that they were given by the institution.
I guess the big question now, Mlu, is can we expect more allegations to surface?
Oh yes, certainly, definitely, because I can tell you that from what we've heard from patients as well as the relatives, there seems to be a whole lot more at the institution. Now, funny enough, just to also paint you a picture, that yesterday we had a brief discussion with the management of the Durban and Coastal Health Facility, Mrs. Gita Harry. In fact, when we posed a few questions at her, she got very jittery, just reading a statement saying that she will not be taking any more questions from the SABC, because she feels feels as if that there has been a smear campaign that has been going on there. Now, funny enough, that some of the people that we have spoken to happen to be people that have patients over there, and they also happen to be people who said that in future they would like to engage more with the SABC, they'd like to interact with the SABC and expose a whole lot of transgressions that's happened in that particular area. But I can also assure you and confirm with you that as the week progresses, we promise to give you a whole lot more about this story as it develops, and also just to bring you up to speed with our interaction with the management of that particular area. We assure them that each time when the SABC does a story, we will be very independent, we'll be impartial as well, and each time we do a story regarding that particular institution, we will give them an opportunity to have a right of response. And of course, we did that yesterday with Gita Harry, and she did not take it too kindly. But of course, there's been a whole lot more of allegations that have been tabled and that have been given to the SABC, and which at the moment we are addressing them as we've said earlier on.
Okay, Mlula, that's where we'll have to leave it. Great reporting there, Mlungisi Khumalo, down in Durban. Thank you very much indeed for your reporting. Well, President